Here in this module, we will be discussing about detailed anatomy of ovaries. So the contents of today's session are the structural relations of ovaries, blood supply, innervation, lymphatics and clinical anatomy of ovaries. The ovaries are a bilateral pair of flattened egg-shaped intraperitoneal discs that reside just within the true pelvis. So here in this image we can see the location of ovaries in the true pelvis. So they are located in the true pelvis posterior to the broad ligament in the ovarian fossa of 𝗲𝐷𝐼𝐻. So between the divergent external and internal iliac vessels. So in the lesser pelvis we can see here, this is the common iliac artery which is dividing into external iliac artery and internal iliac artery. And we can see the location of ovaries at the site of division of common iliac artery into external and internal iliac artery. So it is located between the divergent external and internal iliac vessels. So not only artery, along with the veins, we can see they get diverged near the location of ovary. And behind the ovarian fossa of 𝗲𝐷𝐼𝐻, retroperitoneal structures including the ureter. So we can see the ureter, internal iliac vessels, which includes both internal iliac artery and vein, obturator vessels and nerve, and origin of uterine artery. And ovaries have superior and inferior pole as well as anterior, posterior and medial surfaces. So superior pole, inferior pole which later becomes horizontal, and it is having anterior surface, posterior surface, medial and lateral surfaces. And ovaries are ovoid in shape in measure. So if you see the outer lining of the ovary, it is ovoid in shape. So if we see the ovaries, they are ovoid in shape. So the outline is ovoid in shape. And they are pinkish and smooth at birth, and after puberty they become rough due to ovulation. That is approximately 1.5 to 3 centimeters in length, and width is around 1 to 2 centimeters. The thickness would be around 1.2 to 1.4 centimeters in thick. So these are the dimensions of the ovaries, and the weight of the ovary is approximately 2 to 8 grams. It weighs around 2 to 8 grams, and they are the double in size in pregnancy. Let's see its anterior view or ventral view of ovary. So ovaries are surrounded by fibrous connective tissue which is known as 𝗠𝐞𝐝𝐢𝐵𝐺𝐼𝐻. So we can see the ovary is surrounded by fibrous connective tissue which is called as 𝗠𝐞𝐝𝐢𝐵𝐺𝐼𝐻. So this 𝗠𝐞𝐝𝐢𝐵𝐺𝐼𝐻, which lies deep to superficial sheath of cuboidal epithelium. So we can see peripherally it is lined by the cuboidal epithelium, and deep to the capsule is the cortical layer in which the ovarian follicles reside. So the peripherally it contains the cortical layer, where we can see different stages of follicles in the cortical layer. And in the third layer, which lies beneath the cortex, is known as vascular medulla. So the outermost layer would be the capsule. Deep to the capsule is the cortical layer, where we can see the different stages of follicles. And the innermost layer, which is present in the center of ovary, is formed by the vascular medulla. In neonatal females possesses around 1 million primordial follicles. About 96% of these follicles degenerate by the time of puberty. The normal ovaries of pre-pubescent females will have several primordial follicles developing during a menstrual cycle, and typically only one follicle achieves full maturation to release a viable ovum in the process of ovulation. So during the process of ovulation, only one reaches to the stage of Graafian follicle to release the ovum. So this is almost like a superior view from above, seeing the lesser pelvis. So this is the anterior aspect of the lesser pelvis, and where we can see the posterior aspect here containing the rectum on the posterior side, and anteriorly behind the pubis is urinary bladder, and this is uterus, and here are the ovaries. The anteriorly ovary is related to broad ligament. So here is the fold of peritoneum, broad ligament. And it is related to the ovarian vessels and mesoovarium. So this connection is the mesoovarium. So within the mesoovarian, ovarian vessels are present, supplying the ovary, and also the obliterated umbilical artery. So these are the structures which are related anterior to the ovary. Let's see the posterior relations of ovary. Posteriorly, it is related to ureter. So here is the ureter. So from the anterior view, it is where you can see the urinary bladder here and partially removed uterus, and we can see posteriorly rectum and the lesser pelvis. So here is the ureter, which is related to the posterior aspect of the ovary, and along with the ureter, it is also related to internal iliac vessels. So these are the internal iliac artery, and this is the internal iliac vein, together called as internal iliac vessels, and also it is related to the pelvic wall. So posterior pelvic wall, it is formed by psoas major muscle and iliacus on still more posteriorly. So the posterior pelvic wall will form the posterior relations of ovaries. Let's see its superior relations. Superiorly, it is related to external iliac vessels. So here is the superior relations which are related to external iliac. These two are the external iliac vessels, making both artery and veins together. So inferiorly, the ovary is related to levator ani, which is a pelvic floor muscle, and medially it is related to ovarian ligament. So here we can see the ovarian ligament. Connecting ovary to at the junction of body and the fallopian tube of the uterus, you can see the ovarian ligament. And laterally, it is related to obturator vessels and nerves. So these are the relations of ovaries. So let us talk about the structural relations of ovaries. The ovaries are situated on the inferomedial fashion when the subject is in the anatomical position. So the superior pole, which is otherwise called tubal pole, is covered by the fimbria. So this is the tubal pole, which is covered by the fimbriated end. So fimbria are the finger-like projections of the uterine tube. So that is related to the superior pole or tubal pole of ovary, where the finger-like projections are seen here. Then superior pole is attached to the suspensory ligament of ovary. So we can see the suspensory ligament of ovary attaches to the superior pole, which anchors the ovary to the posterior pelvic wall, and but also gives a way for ovarian vessels to pass through. So here are the ovarian vessels. Which are along the suspensory ligament of ovary. Additionally, superior pole is related to vesicular appendix, which is otherwise called as hydatid of Morgagni. Inferior pole. Inferior pole is directed towards the body of the uterus and has a connection thereby a way of a ligament of ovary. This is ovarian ligament or ligament of ovary. So different form of suspensory ligament of ovary. So the ligament of ovary progresses as a round ligament. So this ligament of ovary further continues as the round ligament. So the ligament of ovary progresses as the round ligament, both of which is derived from the gubernaculum. So which secures each ovary to cornu of the uterus. So furthermore, each round ligament also attaches to the inner part of labia majora. The meso-ovarian, which is a double layer of peritoneum, secures the ovary at its anterior surface to the posterior part of broad ligament. So here is the posterior part of the broad ligament. So anteriorly the ovary is secured by meso-ovarian. With the exception of this part of ovary, the rest of the organ is covered by a sheath of cuboidal epithelium and not by peritoneum. So the posterior surface of the ovary is exposed to the peritoneal cavity. So the posterior surface is exposed to the peritoneal cavity. Whereas anteriorly we can see the meso-ovarian fold of peritoneum which anchors the ovary to the broad ligament of uterus. Despite of all its attachments, the ovary is very mobile, especially in women who had children, and it is frequently found behind the uterus in the pouch of Douglas and has a variable relationship with the uterus. So antiflexed uterus, that is lateral or posterolateral. If the uterus is antiflexed, as it is shown in this image, here is the uterus which is antiflexed. In antiflexed uterus, the ovary could be lateral and posterolateral. And if the uterus is retroflexed, the position of the ovary is superolateral. So blood supply of the ovary, the ovarian arteries, which are the direct branches from the anterolateral aspect of abdominal aorta. So here in this image we can appreciate abdominal aorta. Where we can see a direct branch, ovarian arteries, which arise from each side of the abdominal aorta to supply the ovary. So the ovarian arteries, which are the direct branches from the anterolateral aspect of abdominal aorta. They arise bilaterally just below the origin of renal arteries. So here we can see the ovarian artery gives several tubal branches to the fallopian tube before anastomosing with the ovarian branch of uterine artery, which is a branch of internal iliac artery. So before terminating by anastomosing, it gives rise to several tubal branches. So that was about the arterial supply. Next, about the venous drainage. On either side, the ovarian veins begin as pumpeniform plexus. So we can see the pumpeniform plexus. So pumpeniform means like a grapevine coiled plexus. So pumpeniform plexus in the meso-ovarian before they form two left and right ovarian veins. So they form two left and right ovarian veins. We can see the left So along its path, the pair of veins on each side fuses to form a single left and a single right ovarian vein. So finally they continue as single right and single ovarian vein, and left ovarian vein drains into renal vein and the right ovarian vein drains into inferior vena cava. So let's see the innervation of ovary. Preganglionic fibers of lesser splanchnic nerves T10 and T11 synapse at the aortic ganglion at the root of the ovarian arteries. So here are the ovarian arteries. So near the origin of the ovarian arteries, we can see the nerve plexus which are present near the aorta called as aortic ganglion. So these ganglion are the aortic ganglion, where the lesser splanchnic nerves synapse in the aortic ganglion. The postganglionic nerve fibers then travel with the ovarian artery to provide vasoconstriction innervation. So postganglionic fibers, they run along with the ovarian artery. To provide vasoconstrictive innervation. And postganglionic fibers from inferior hypogastric plexus, which receive the fibers from preganglionic pelvic splanchnic nerves, provides parasympathetic innervation to the ovaries. So inferior hypogastric plexus provide parasympathetic innervation to the ovaries. So here are the hypogastric plexus. Which supply the parasympathetic innervation to the ovaries, and these fibers travel along the uterine arteries and are vasodilatory in nature. It is important to note that the denervated ovaries are still capable of ovulating since the process is hormonally regulated. So let us discuss about the lymphatics. There are three pathways for lymphatic flow from ovaries. Superiorly to the para-aortic lymph nodes adjacent to the ovarian artery. So adjacent to the ovarian artery, we see the para-aortic lymph nodes which drain into para-aortic lymph nodes. Which are adjacent to the origin of ovarian artery. So ovarian artery arises from the abdominal aorta. So inferiorly to the medial group of superficial inguinal lymph nodes through the inguinal canal along the side of round ligament. So inferiorly to the inguinal lymph nodes. So which drain along the inguinal canal along the side of round ligament, and horizontally to the opposite ovary across the uterine fundus. So horizontal draining is to the opposite ovary along the uterine fundus. So that was about the lymphatic drainage of ovaries. So clinical points. Pain arising from ovaries is perceived at periumbilical region. So this can be mistaken for appendicular pain, since painful sensation from the vermiform appendix is also perceived by the patient in this area. So the presence of adnexal means fallopian tube, ovaries and adjoining structures that is adnexal tenderness, and the absence of migratory pain from the umbilicus to the lower right quadrant should aid in differentiating between appendicitis and ovarian pathologies. Additionally, ovarian pain can also be referred to the medial aspect of the thigh by the root of adjacent obturator nerve. So that was about the referred pain due to pathology in ovary. Benign cystic lesions are the most frequently encountered pathologies of ovary. They can either originate from ruptured or whole Graafian follicles, that is cystic follicles, or as a luteal cyst, which are the normal cyst lined by the luteinized granulosa cells that subsequently rupture. So cysts may be singular or multiple in occurrence, and they may also be functional or unlike neoplastic ovarian growths. Next, regarding the polycystic ovarian syndrome, which is an intricate disorder of the ovaries in which there are high levels of androgens, a menstrual cycle without release of an ovum, and abnormal menstrual cycles and reduced fertilities. So this completes the anatomy of ovary. Thank you.